if there's one or two things that set us apart from anywhere else in the world, the first I would say is probably the breadth of experience. The fact that we've been doing it for such a long time and so many people are involved in here and so committed to it that everybody that you see in the whole program sort of lives, eats, and breathes what's going on with intestinal rehabilitation. And I think that's a pretty big plus for our program.
One of the first things I tell the families when they get here is that this is a family, and this is a lifelong relationship that we're going to have. You know, these kids come very young, or when older kids come. This isn't a program that just sees you and sends you home. We see these families, these patients, for the rest of their life, and it starts from the minute they call for their referral. It starts from the minute they walk through the door. Every time we talk, it's more or less, how are we going to make this work? How are we going to work together to be successful?
What we really want to do with a patient who has intestinal failure is we want to get them to the point where ideally they can take everything, food and water, by mouth. And we have different pathways to get there. Rehabilitation is saying we're going to try to use what you have, and we're going to do everything that we can think of to use what you have to try to get you to the point where you don't need intravenous feeding and you can manage on your own. And so that almost becomes our default pathway when people come to us. We say, what can we do with what you have already? Now, what transplant then becomes for us is this wonderful safety blanket that we have.
These kids, they can lead just fully productive lives, regardless of the need for transplant or not. You don't need to live, in a bubble. You don't need to be sheltered. You need to live your life. And that's what I'm hoping that these kids do, 5, 10 years from now. Most of these families, when they come, they are basically been told to prepare for the worst. This child's not going to make it without an intestine. They're going to die from liver disease. They hear all sorts of horror stories.
And that patient or that child may be the only person that doctor has that diagnosis, or maybe there's a couple. Maybe they're the only person that they've ever met that has this condition. And then they come to a place like Nebraska where this is what we do. And they come here and there's a clinic that's filled with people that have the same concerns as them, the same issues, in many cases the same diagnoses.
Do the testing that needs to be done, look at all the options, and then we go for it. And the biggest thing is when they come here, they've been just so prepared to expect the worst that when we're trying to teach them to expect the best, and we're going to try to get you out of the hospital next week so you can be a family and be home, or at least be in Omaha. It's like it's such a shock to them.
It's so much more than any one person. It's not all about who's your surgeon or who's your physician. It's what it is it's that everybody that you work with, everybody that you see knows what's going on, and they're all engaged in a common purpose of trying to help you through your intestinal rehabilitation, through your transplantation, through whichever element of the treatment scheme it has to go. And that's from myself through all of the nurse coordinators, the nurse practitioners, the dietitians, just other people that you might not commonly think of as a new patient. Patients on the ward, the care technicians, the people in the kitchen. Everybody has this common purpose, and everybody kind of knows what's going on, and everyone's very familiar with what's happening. And I think that's part of that feeling of reassurance and stability, and the sense that people get that everybody here does really sort of know what's going on, and they're all working towards getting you better. Is when we go to conferences and we see people speaking from all over the world about transplantation, and what always strikes us, and we often laugh about it, is how so many of them have come through Nebraska. So not only have we done lots and lots of transplants, but we've really trained an entire generation of clinicians who work all throughout the world, and all through Europe, all through Asia, all through North America. And they're all people who've come through Omaha, and they've learned that stuff here. Because we've been there right from the beginning, if you look at single institutions and single hospitals and who's done the most pediatric transplants, Nebraska's done the most in the world. So it's basically like of all of the children who've ever been transplanted in the world with intestines, about a third of them have been done here in Nebraska. So I think that's kind of a testament to the longevity and the stability and the experience of the whole team in transplantation.